All right, schools have been in session now for 3 or 4 weeks, and many are now dealing with COVID issues among students and staff. We are joined live this evening with Dr. Katie Anstadt. She is the superintendent of Washington Local Schools and is a partner of the V Project. Doctor, good to see you as always. We talked a number of times weeks ago as your district was deciding what to do about masks. So, question tonight, what sort of COVID issues are you seeing in your district right now?
You know, I think the number of positive cases among students is a little bit alarming to us. We were on a call yesterday with presidents and CEOs and nursing directors from hospitals all around the state. And we saw this in Lucas County, where we were in an emergency situation with emergency rooms being at capacity. I think the 0 to 17 statistic, I'll share that at our board meeting tonight, is alarming. The number of our kids that are getting ill is alarming, but I think honestly right now that's our biggest challenge, is making sure our kids stay safe.
You said you're going to share a statistic. Can you share it with us right now here so we can?
Yeah, so I'm going to share a lot of statistics tonight. Most of them right off the health department. Our local health department's doing a really nice job compiling data for us so that we've got real-time data. One of the statistics that I watch is the number of our vaccine rate within our zip codes in Washington Local. That comes right back to us, 43613, 1206, 11. So I'm watching those vaccine rates, and I'm also watching the infection rates. And unfortunately, we don't have a good balance there. We have a very low vaccine rate in those zip codes with a very high infection rate. And we're seeing that kind of play out at school as well. I think the shocking thing, we didn't have as many positive student cases last year. The number of positive student cases is alarming to us. On the health department website, you'll see an exponential growth in that school age vaccine rate, the school age infection rate, 5 to 17. That's concerning to us. We certainly see that playing out here.
I know you had talked when we talked a few weeks back about having another vaccine clinic, affording the kids a chance to get the shot. Have you talked more about doing more of those? Have you had one yet?
So we did have one right before school started, and then the second vaccine was September 1st. It was not well attended. I think that's a frustrating part to us. I think once we got into school and kids started to feel the real effects of what it would be like to have quarantines, that rate probably went up a little bit. Among our employees, we're incenting our employees to get a vaccine. So we're excited about that. We're excited they have until October 13th to receive an incentive from the district. We think that healthy kids, healthy staff, that equals a healthy community. So we're just going to keep pushing the things that we can push. Safe procedures, doing a really great job. I think, Jeff, the one thing is we're not seeing spread at school. The masking is working, and that's important to us.
Dr. Anstadt, we got about 30 seconds left. Talk about staffing. How are teacher numbers? What about substitutes? What about bus drivers?
Bus drivers, obviously, we're all anxious for bus drivers. We had to cancel practice golf, our transportation to golf practice today. We're always concerned about any kind of what we call field trips after school. We're barely making our routes with our drivers right now. Drivers, and obviously we always need subs. We need substitute teachers as well as our support staff as well. Everybody together is what makes this work. So if you're out there and you'd like to pick up a couple of days a week, we'd love to have you as a sub.
But is it so bad you're having to double up classes on one teacher?
So a lot of our teachers are losing planning periods. When we don't have enough subs, then we have to take those planning periods. Somebody might say, well, I don't get a time to plan during my day. Well, but we get time to run to the restroom and things like that. When you have kids, you really can't leave them alone. So not having a planning period really impacts everyone. It impacts our mental health as well. We need a break. We need time to plan for the next class, get copies made, get prepared, get science experiments out. So, all this extra coverage is tough on teachers. So we need subs, definitely need subs.
Dr. Katie Anstadt, she is a partner of the V Project as well as the superintendent of Washington Local Schools. We appreciate, as always, your frank discussions that you have with us here at WTOL.
I appreciate you getting the message out. Thank you for that help.
You bet. Melissa?